Well, I've been talking to everybody that know me. We're going to get into the 4 parts of Medicare and explain that to you. But let me show you something. See this card? Everybody know this card, right? And you probably know, you're probably aware. Some of you who are aware, fine. This card is changing. To everyone in the United States, you're going to get a new card. You're going to get this card. You're going to get this card. Now, what they're telling you is when you get this card, is throw this one away. That's what they're telling you. I'm saying keep the other one. Put it somewhere in your safe deposit box. Because remember, every hospital, every doctor, every clinic that uses this card got to change their record. And in the odds of that happening by December 2019, I would question. The reason why is because something happened. The computer goes down. You didn't get it. You know how a lot of times they say they mailed you this card and you say, I didn't get it. Now you at your doctor and you say, well, it should be in the system. The whole country is changing it. And then look, the person you're talking to may say, well, ma'am, I don't see it. But you didn't throw it away. So you haven't gotten this one, or you're supposed to be mailed to you haven't gotten it. The reason why they're changing it is because they're taking your Social Security number off that card, because that's where your fraud and scam is coming in, and that's what's causing the system so much problem. Some of it is intentionally, some of it is not intentionally, but that's why. And this card you're going to be able to carry around with you. This card you can't. That's the number one thing happening. It's starting right now. Some of it is being mailed out, and hopefully everybody get it. With that card now being changed, it's going to help a lot by fraud and scam. Everybody get a Medicare and U-book in the mail. And I teach the program across the state. I teach the book. So what I'm telling you is not what I think, what I feel, what I believe. I teach the book. Nobody teaches the book in the state. I'm understanding very few people teaching in the country. So if you don't know the book, if you don't know your rights, if you don't know what you're supposed to get, if you don't know that you can appeal things, if you don't know, you just have to just say yes, say, oh, okay, well, that's all I can do. Like the lady said, I don't want to worry a doctor. No, you got to tell a doctor what's going on when you go visit. But this book changes every year. That's the reason for that, because the program changes every year. There are 4 parts of Medicare. And there's only 3 ways you can get Medicare. Well, actually, 4, but 3 ways is 65 and over, under 65 and disabled. And if you have end-stage renal disease. Now, people my age, y'all might be my age, you know, under 65 disabled, certified disabled, amyotrophic lateral sclerosis, known as Lou Gehrig's disease. A lot of young people don't know who Lou Gehrig is, the baseball player that developed the disease. Now, the thing about this is the way you can get it. People think you have to be over 65 or old to get Medicare. You can be 2 years old. If the Social Security Administration certifies you disabled, you can get Medicare. People with end-stage renal disease can get Medicare. Again, the controlling factor, the person that makes all of the decisions is Social Security Administration. Okay? So that's the way you can get Medicare. And a lot of people that are turning 65, and always we get this picture of senior citizens. 10,000 people turn 65 per day. That's over 3.6 million a year. And I don't care if they're architect, engineers, whatever they are, they don't know what to do. When you're turning 65, there's a 7-month window. 3 months before your birthday, the month of your birthday, and 3 months after. If you miss that window, that 7-month window, you're penalized 10% for twice the amount of years that you missed it. So if you miss it for 1 year, you're penalized 10% for 2 years. Okay? The same thing applies to Part B if you have to get Part B. And the only way you don't get Part B is you're working, you're still working, and your company have what you call credible credit, which is the same thing as Part B. But if you're in doubt, or your company credit is not credible, and you miss signing up for Part B, you're penalized 10% for the rest of your life, for as long as you have Part B. Are you aware of that? You also, when you're turning 65, you must have a prescription drug plan. So if you're turning 65, you got to sign up for Part A. If you sign up for Part B, you got to sign up for Part D. If you didn't have a prescription drug plan, you're penalized 1% per month for every month you didn't have a drug plan. So you could be penalized 32% when you're turning 65. I'm telling you this because you all that are on Medicare already know this. But there are people who are 64 and turning 65. It could be your sisters, your brothers, your cousin, your uncle, your friend. They don't know. They don't know what to do.
My sister lives in Connecticut. She pays more than I do. And I thought it was like the same everywhere. Is it not the same?
A and B is the same everywhere, not C and D.
What you pay.
Right.
Yeah.
It's not the same because it's based on your income. People who make $85,000 as single to $170,000 as a couple pay $134 a month. It just went up. Okay, $134 a month. The people who were in the system already and having automatic taken out of their check because the cost of living didn't go up until a few months ago, it didn't go up on them because there's no way they can increase their income. It stayed down to, it used to be 104, now it's 109. So it's different. A gentleman who's making $300,000, $400,000 called me up. He wanted to know why he's paying $348 a month, and his brother-in-law is paying $134 because he's making between $350,000 and $400,000. That's why. Okay, but hold your question to the end because he give me a very short time. This is just 7 months window I was talking about. They 3 months before, the month of, and 3 months after. And you see, you may have a penalty if you don't enroll when you initiate enrollment. You're only turning 65 once. That's why they call it the initial enrollment. If you miss it, well, they give you another time. You can sign up between January 1st and March 31st. But guess what? You still got the penalty.
Why do they charge you penalty?
That's something you got to actually cover. You ask me something, I get it. But here's the deal. And here's why I answer it. You work 10 years. If you work 10 years and 40 quarters, you paid into the system. They took it out of your check called FICA. Okay? It's like buying a fur coat when I was a little boy called a layaway. Everybody put money in a layaway and you pay for it every month. And you pay for your fur coat every month. Now you finish paying for it, but you're not going back and get it. You didn't pay for this all your working career every month, or your husband did it. But you ain't going back and get it? So they penalize you. You know? And
you say 10%, is that your monthly rate? Would be 10%?
Listen to me carefully. I mean, hold your question answer, but it's $134 is the premium for Part B. Okay? And what that means is that's a base that changes every year. And the base right now is about $35. So 10% of that is $3.50, okay?
Oh, okay.
So you're going to add $3.50 to your $134. Every year that base goes up, that premium going to go up because your base changes every year. But you're penalized twice the amount of year. But if you miss Part B, you're penalized the rest of your life. So that penalty just keeps going up because the base keeps changing every year. Special enrollment, that's when you say you have credible coverage. The company is paying Part B because you didn't have the time for Part B because your company has the same coverage as Part B. You follow me? But the company decide that, we're not going to do this anymore. Or you're going to retire, and when you retire, they're not going to cover you under a Medicare or a medical program. So you got 8 months to go back and get Part B. And the reason why I said you go to your human resource department, your business administrative department, and you get that copy, that sheet, that's not to give to Security Administration. That's to keep for you. 5 years down the road, 10 years down the road, when you go back and get Part B, they say, well, guess what? You should have signed up for Part B 10 years ago. You said, no, I shouldn't, because I had credible coverage. They're going to say, prove it. But if you don't have nothing, you say, well, I talked to Mary at the Social Security Administration. Well, we were married 10 years ago. She might be gone. Burden of proof is always on you. But you got 8 months to go back and get it. This is your part of Medicare. People don't know that you can get Medicare 2 ways. You can get it through what you call original Medicare. You can get it what you call Medicare Advantage. It's up to you. Here's the difference. Original Medicare is A and B. You just ask the question, is it universal? It is universal. A and B is the same all over the country. That's your Medicare. People will say, I don't have Medicare, I got Humana. You have Medicare. Because Medicare Advantage plan, A and B is inside of that. It's called a bundle. And when you got a Medicare Advantage plan, You have A and B inside of it, and you have a drug plan. Good. Good thing about a Medicare Advantage plan, no matter who you go through it with, and they're all in the back of your book, whether it be Humana, People Health, Advantage, whoever, it's only in the parish that you're in. It's not mobile. So if you have a Medicare Advantage plan in Baton Rouge, and you move to Orleans, you're out of network. Now, you can say, well, I got Humana. Well, find out. Yeah, Humana's all over, people across all over. But, you know, in North Louisiana, People Health is not in North Louisiana. So a Medicare Advantage plan is not mobile. And if you got to choose a plan, you got to choose the one in the parish you're in. Original Medicare, A and B, is mobile, it's universal. But you have to get a supplement for that 20% you have to pay, because Medicare pays 80%. And you got to get what you call a standalone drug plan. Yeah? A Medicare Advantage plan, if you don't go to the doctor, you don't pay. Because when you go there, you got to pay your co-pay and your deductible, right? But on original Medicare with a supplement, that supplement got to be paid every month. And a supplement can cost you anywhere from $150, $350, $450, depends on a lot of different things. The benefit is standardized, but the costs are different based on who you go with. You can go with AARP, you can go with Blue Cross, whoever you choose. It's a whole lot all over the country. But that premium is based on age and health and everything else. That's the two ways you get. And people, when they choose a plan, people always ask me, what is the best plan? You know what the best plan is? No. Best plan is the one your doctor takes. If your doctor do not take whatever plan you have, you got to change doctors. That's the issue. My sister, you hear this, my sister got Humana, and I got People's Health, but Humana's better. If that's your choice. You want to go with that? Fine. Couple say, well, my husband got this and I have that. We want to put them all together. Okay, that's fine. But guess what? You got to change doctors. You got to change hospital. You got to change pharmacy. Oh, and you got to be careful of that. You got to analyze everything. Because that don't mean the plans aren't good, but it's what your doctors accept. Then the next thing is, does the plan cover all your meds? Why get a plan that's covered? You're taking the average person on Medicare taking 15 meds a day, which is too many, but 15 meds a day. So if you got a plan only covering 10, the other 5 costs got to come out of your pocket. So you want a plan, your doctor accept, unless you want to change your doctor. That's why you have open enrollment every year, October 15, December 7. Because you can change, but you're going to change doctors, you're going to change hospital, you're going to change pharmacy. So find out from your doctor, make sure it covers all your meds, make your decision. Because we know also that third thing is cost. And all the costs for different plans in the back of your Medicare and U-book. What slide I want to go to? Here's the thing, Medicare Part A. You have 4 parts of Medicare. Watch how simple this is. You have A, B, C, and D. And the only alphabet of the parts of Medicare makes sense is D. Because it stands for what? Drug. But you're going to find out what A covers? Here's how you find out. Here's how simple it is when I'm teaching. A is hospital. That's it. But the key word is you got to be inpatient in a hospital. You got to be inpatient in a skilled facility. Now, just because you're in a hospital room and you're getting all the service and everything doesn't mean you're admitted. And if you're not admitted, Medicare Part A doesn't cover it. You must be inpatient or admitted, same word. Okay? The problem has been happening that now has become mandatory as of April 8, 2017, is the word observation. When you hear that word, you call your doctor because observation means that you're going to pay the bill. because you're not admitted. We're going to keep you 3-4 days for observation. Well, Medicare said Part A, to put Part A on the hook, you got to be inpatient. And if you're inpatient and they got to transfer you to a skilled facility, you must have been in a hospital 3 days before you can be transferred to a skilled facility. So you got to know the word. Medicare Part A covers blood, inpatient. All the medicine you get in the hospital while you're getting it is covered under Part A while you're in the hospital. And Medicare Part A also covers, outside the skilled facility, home health care. And do you know home health care is free? Home health care is free based on how you live. Now, let me tell you the difference. You got to know your plan now, and you got to know what you have. You have original Medicare, you have Medicare Advantage. That's why one size don't fit all. That's why you sign that sheet so we can sit down. You tell me what you got and what the issue is. But a lot of people don't know their plan, or it wasn't explained to them properly, or it's changed. Because Advantage plans are private run. And they can change. Another thing is hospice. Okay? Hospice. All hospice is going to do is make you comfortable. But you do pay up to $5 for medicine, and you do pay 5% if you have to put you in a respite care. But those are the things that covered under Medicare Part A. And if you want to get into your personal one in detail, someone call you up, you sit down and talk about it. If you want to go into any of the office, we can talk. I'm right here in Baton Rouge at the insurance department. But that's what SHIP does. They can help you understand your plan. Don't assume it's in the book, okay? Don't assume it's in the book. You call me up, I say, get your book. Tell you the page it's on. Or if you got a policy that's different, call up your agent. Call up a guy that sold it to you. Call up Humana. Call up whoever you have it with. They're not bad. They're not trying to sell you something bad. They want to make sure you understand what you have, because you don't need to understand it once it happens. You go to the hospital and you find out, well, they don't pay this. Well, did you do prior authorization? Did you and the doctor in the hospital and the social, did you all get together and do a prior authorization? You know you were getting operated on. Did you do a prior authorization to find out if it's covered? When I had my physical, doctor examined me, and I hate going to doctors because I hate needles. And he said, have you had a pneumonia shot? I said, no. He said, you want one? I said, yeah. I said, it's going to cost me? He said, no. Okay. Then he said, how about an osteoporosis test? I said, is it covered? He said, I don't know. I said, well, find out. When y'all find out, call me. I come back. They had to get prior authorization. They called me back 2-3 weeks later. I went. Don't assume, because plans are different. Mm-hmm. That's the 10 years I was talking about. Another thing that happens in inpatient, everybody want to give their loved one the best care. Everybody say, oh, I want a private room for my dad, I want a private room for my husband. Medicare does not pay private room. Follow the plan, follow the rule, because my family had a rude awakening because they didn't listen in the private room and the TV and everything else and all the different things. And when my father-in-law passed away, $10, $15, $20,000 bill come in. Well, how that happened? Thought they had cover. You didn't follow all the rules.
Some hospitals don't have semi-private rooms.
I know. I just have to talk to them about that. Okay. But they're gonna pay up to that semi-private amount.
Okay.
But you gotta know what your plan says. These figures have gone up, and when you go into the hospital, your first 60 days is called a period. That's your deductible. That's what you pay. Unless now there's some plan, and there's some people who qualify based on gross income. There's some other help. There's some help out there. Extra help, Medicaid, things like that. There's extra help out there. But your deductible, and these figures goes up every year. They change every year. And the reason why, that's one of the biggest problems right now. They're trying to figure out, well, how can we control some of this? Well, the way you control some of that is that figure now that you see on the screen up there, and these are new. We just got these. You can pass them out for me. That figure has gone up to 1340 for that 60-day period, 1340. So you don't want people to be in the hospital beyond 60 days. So that 1340. Then you're talking about 61 to 90 days, you start paying $329 a day. To see what you pay. And then from that 90 to 150, you see what it is. Now, the deal is this. You can go into the hospital for 4 times a year for 4 different issues, and you got to pay those figures again. They change every year. On the back of that document that you have being passed out, you asked me, the lady right here in the blue top right here, like behind you, she said, well, how is it different? Well, if you look at the back of that, it tells you about your income. Single, 85,000, couple, 134. But if you go down, you see how the premium increase.
Oh, it's the money you make.
It's the money you make. How do they know that? Because of the taxes you file.
So they have access to your tax return right in.
No, it's the prior 2 years. The prior 2 years.
So are you saying that,
Again, if you can hold your question, because I can rush you through a lot of things, but I'm going to answer your question for you. Semi-private. Same thing applies in a skilled facility. Semi-private. And you got to follow all these different rules. And you see ambulance down at the bottom are limited. The reason why people get a lot of ambulance bill is because, and you always got to fight that. You can fight and appeal anything. You can appeal up to 5 times. Just because you call an ambulance and get rushed to the hospital doesn't mean Medicare is going to pay that ambulance bill. The deal of it is if it's life-threatening, number one. Number two is there's no other form of transportation where you can get that person there. I had to do an appeal I had to go to the 3rd appeal, which means you got to go before an administrative law judge. And you got to have something different, some documents, some facts different to get them to change. And this was a large bill. So just because, now, when it's life-threatening, and it's always a good fight. It's a good fight, and so far, I'm 10 out of 10. Because you can't expect a spouse, man or woman, to determine when their loved one is on the floor, should I call an ambulance or not? Number one. Number two, are they bleeding internally? You don't know, you're not a doctor, but if EMS come out with all of this thing and let them decide. But it's always a fight. Sometimes it's a court error when they appeal. Sometimes certain things haven't been presented, certain documents. The key thing of it is the primary care physician statement. And in one case I had, the primary care doctor said this patient could not fall, not even once. And he fell. So she had to rush him to the hospital. 4 o'clock in the morning, who you gonna call? Your sons them might be across town, your neighbors them might not be at home sleeping, nobody. You don't know what to do. You can't. And then if you got a husband or spouse that's weigh 175, 180 pounds, and you only weigh 100, how you gonna pick him up? What you gonna do? How you gonna get him a car? So that's down there where I say limited, that's what it means. Because it's always, like I say, don't assume anything. Remember I told you, you must be in the hospital 3 consecutive days before you can transfer to a SNF, skilled facility. Now, when you get transferred to that skilled facility, your first 20 days, now, don't get that confused. This is Medicare. Don't get confused that if you work for a company that have group insurance, your husband retired. I had a lady, her husband was a sheriff, he retired. She said, well, I've transferred him to a skilled facility, but they only tell me my first 6 days are free. But I got to pay the rest. It was group. It wasn't individual. So you got to know what's going on. There's always a little something that's trigger what you understood and what they're saying, and it never meets sometimes. Of course, 21 days to that figure has gone up. And it's on your sheet as well. Again, 5 requirements for home health care. You must be homebound. You must need to have care on part-time or intermittent basis. You must be under the care of a doctor, receiving service. Face-to-face could be the doctor, or it could be the nurse practitioner. Home care agency must be Medicare approved. And again, In original Medicare, you pay. Somebody said, no, well, we got to look at what plan you have. What's your original Medicare, A and B. I didn't say Medicare Advantage. And what it says up there? Durable medical equipment. Anything that's used to help you or patient, anything used to transmit medicine called durable medical equipment. 5 years ago, biggest scam, biggest fraud. You all heard about the scooter store. Closed down because everybody had a scooter. They owe Medicare over $100 million. Fraud, scam. You know, buy this, get this walk-in tub, and you don't pay nothing. No. You pay 20% for any type of durable medical equipment. Medicare will pay 80%. But you must go now to certified contractors to keep you from getting scammed. Doctors know who they are, clinics know who they are. But they were just scamming people. People were, I met a lady, she told me, after Hurricane Katrina, she lost her scooter. She said, I got to buy another one. I said, did you buy the first one? She said, yeah. I said, and you bought the second? Yeah, I bought the second one. I don't have the money. And I said, you only have to pay 20%. She got scammed. Hospice again. Okay, Part B, the same thing. This is Part B. Part B is called medical insurance. And everything outside of the hospital when you're not an inpatient, you're not admitted. That's Part B. And doctor service, outpatient medical, clinical lab, durable medical equipment, diabetes testing. In the book, I call Part B the bomb. In the book, when you talk about Part B, and if you want to know how to look at it in the book, on page 15, it's the diagram I'm talking about in your book. Page 15 in your book. It not only gives you the full parts of Medicare, but it tell you what to find in the page to get more detail on it. And when you talk about Part B and you go to page 34 in the book, 34 in the book, and I was telling the ladies earlier about the ALPA. The ALPA means it's a preventive maintenance. If the doctor takes the assignment, you can get preventive maintenance. They can do some things to tell you what might happen to you later on. But it goes from page 35 to page 59 when you get in your book, and you're going to see all the things that it covers. I mean, it's unbelievable the thing Part B covers. Have you ever seen it in the book? It's a lot. That's why when you talk about credible coverage, you know, you want to make sure that it's as good as Part B. To flag the sign on me. When you talk about Medicare, I'm going too fast. When you talk about Medicare Part C, you're talking about the Medicare Advantage Plan. Medicare Advantage Plan is Part C, which means another name for Medicare Advantage Plan, Part C. Another name for it is HMO, PPO. Another name is Humana, WellCare, Vantage. They're all in the back of your book. All those are Medicare Advantage Plan. All those are Part C. Guy asked me, say, I got Part A and B. I got a drug plan. I got a supplement. When am I going to get Part C? So you don't need Part C. You got original Medicare with a supplement and a standalone drug plan. And people get confused because everything is Medicare supplement, Medigap, Medicare Advantage Plan. It confuses people. Now when you got all the other programs out there. Now, when you get down to the last, which is drugs, that's a different ball game. You can have a drug plan from Walmart, Walgreens, if you only take 2-3 measures. But if you're doing a lot of drugs, 15, 20, I've helped a lady who was taking 29 a day, which is ridiculous. We had somebody taking 49 a day. Something wrong with that. Because they all got side effects. What is it carrying? So you want to make sure you get with your doctor and know what you're taking. But there are certain drugs that every company is mandatory that they have, and I'm skipping forward to it. All drugs in 6 protective categories must be in whatever plan you have. See, but you know what you don't see at the bottom down here is Part B, flu shot. You don't see shingles. Shingles is covered under a drug plan, not under Part B. Okay? Those are required. These are excluded. They're excluded. Prior authorization, step therapy, quantity. Prior authorization, save yourself a lot of headache, call. Find out what you're going to be entitled to pay. Step therapy. Now what they're trying to do now, they're going to get you to try a lesser drug. Might be a generic. They're going to try different drugs before they see if they can work. Instead of giving you that brand drug, we're going to cost you. And then the last thing, quantity limit. You used to be able to walk in there and get 90 days of pill. Right now, doctor got to be careful giving you 90 days. You might get 30 days, might get 60 days, because now what's happening is people are selling the excess medicine. Children, grandchildren are also taking the medicine and using it. Now, because of the new law, the biggest thing going on right now is the opioid epidemic. And the thing about that's come from people getting pain medicine. If you had an accident or something, then you get addicted to it. Well, pure heroin will not kill you on an overdose, but fentanyl will. The thing about the heroin epidemic also, you have drugs that can be written, prescription drug can be written by dentists and veterinarians for humans. So those are just some of the things that are going on. Again, don't forget about your card that's coming. Any question you have personally, put your name on the list. We'll call you, have your questions listed down. We can find out things. We don't know. We can call CMS. If you call one of our counsel, we'll call you up. They can call us, and we can find out. We call CMS. CMS give us the final decision. It is what it is. You ask the question, why they charge you 10%? That's something you can call up your comments, say, hey, you know what? Y'all need to do something about this. But they're going to say, you know what? You work for the money. Go get it. No went too fast. Some question, general, not individually. We don't say. You had a question.
When you're talking about these deductibles, $1,340 for days 1 through 60, so that means it's $1,340 for whether it's 1 day, 5 days, or 60 days?
That's your deductible.
Okay.
That's your deductible. Now, they're talking about period. They call that period. And that's for one issue. So you may pay that for an issue. You get a kidney transplant or something removed or operation. But you go back in for something totally different, you got to pay the deductible again.
So this is only for
That's your deductible.
okay, but not if you have a C. Not if you're using Part C. It would be whatever the plan.
Whatever your plan is. Every plan,
All right.
when you're talking, I got to know what your plan is. Because there's some plan that might be private plan, So your plan, you can't sit by your neighbor or your sister or your spouse, your husband, and say, okay, why are you doing this, why I'm planning it? Okay, let's see what the plans are. And my last thing is, when you go to the doctor, my friend over here say, well, you don't want to worry about the doctor, but here's the deal. My mother goes to the doctor, so now I got everybody going with her for the last 5 years. And so I'm going to the doctor with her. Okay, after the examination, she's standing in the doctor. Well, how you doing? I'm doing great. It's all good. Everything is fine. How those pills working great? Or any other problem? No. Doing what I'm supposed to do. You haven't told the doctor nothing. Doc, you gave me a brand name drug. I can't afford it. Or the side effect on this thing, I'm hallucinating, and I'm driving. So you got to let them know. Don't be nice, because this is you. This is you. Oh, doc, I fell 3 times last week. Nobody want to say that either. I fell because he don't know. He only can know what you tell him. So, and so just talk up for yourself. You're not being ugly. You're not being rude. But don't just go there, and share your information with your children, because, I come from a large family, 18, I'm the baby. I dealt with debt. I dealt with sickness. I got 2 brothers right now. Both of them got dementia, Alzheimer's, and Parkinson. And I'm telling you, you got to be on it. And sometimes you can't take care. Like I told myself, sometimes you're not equipped to take care of that person at home. Try to get them in some kind of facility. But communicate with your doctor, communicate with your plan, and discuss your plan ahead of time or with your loved one ahead of time, but get your children involved because you can't remember everything. And not only can remember everything, if you're the one that got all the information and you're the patient too, and don't think because that's your son, your daughter, your husband, your wife, that the doctor's going to share information. They can't unless you didn't sign that authorization. It's just things you have to do. The most important person in your life is you. I'm here to help you. Ship is here to help you. One-on-one, we can talk. If you want me to come talk longer and really get into detail, if you got a group, 50, 100 or more, you ain't got a couple of hours. Believe me, when I train my counselor, it's 2.5 days. And you're skipping through a lot of different things. And things change every day. We get every single day. We get calls on something. Company can have a brand name drug this year, and every year you should know what your plan is. Because you could be on a plan right now, and come next year, the plan might be gone. The drug might be gone. True story, I'm going to let you go. True story. There's a parish where a provider left. Now, they got to notify you 30, 60 days that, hey, we're leaving. They left. People were upset. They didn't realize that even though the Medicare Advantage provider left, they still had Medicare. They didn't understand that. They said, wait a minute, I don't have Medicare. Yes, you do. You have A and B. The provider left. You revert back to A and B, but you got to go now and get a supplement for that 20% and a standalone drug plan because you lost your drug plan. Now, you can choose another provider in that parish, but if you only got two, and the hospital and your doctor don't take those two, you got to revert back to a supplement. There's 1,000,001 issues with every situation that don't generalize it and don't think one size fits all because it's different. And there's always something, when you call me up, I talk to you 3 times. Why? Because you call me up, you're emotional, you're upset, you're mad, you're angry. I say, okay. Then I call you back. I say, now tell me that story again. You know what I'm going to learn? Something totally different. Something totally different. And see that 3rd time? Because when I ask you, they're going to ask you, you have your red, white, and blue card? With your red, white, and blue card, 6 things I can ask you in 2 minutes, and then 15 minutes later, I can call you back and tell you what you have, how you have it, what it pays. You can go online and do it yourself. Now you can go online to Medicare.gov, get a username and a password. If you're not a use computer, get your family to do it. Put in your own medicine and everything, change it, keep up to date on your own. Same thing with Social Security Administration. Username and password, find out all the years you work, who you work for, and how much you're going to get when you retire. They're trying to make you do a lot more things yourself now. They flash the card on me. Like I say, if you want to do one-on-one, fine. Any more general question? Go on.
Excuse me. What about vision and dental?
Good question. Medicare does not pay dental, vision, hearing. You didn't see the list up there that said, okay. They tell you what long-term care, that's not Medicare. Okay? The Advantage plan that you may choose, all of them have what you call light dental, light vision, light hearing. That's light now. Call them up and find out, But Advantage plan have that. They also have gym membership. They also can give you 12 trips to your appointment one way or 6. They're competing because they're private run. But Medicare, original Medicare, does not pay dental, vision, hearing.
Advantage.
Your Advantage plan, you pick whatever one you want.
I was told Medicare now is going to enforce, if you're on medicine, you must see your doctor twice a year. Prescription.
No. Now here's the deal. There's a word that you always can use, and it's always going to help you, especially when you got issues you're not sure of, or you want to appeal, and that's medically necessary. That's how I find out. If the doctor, see, even though the plans are all great, your doctor is the quarterback. Your doctor is the person to say, I don't care what you say, it's medically necessary that she has this drug. Now they got to work out how they're going to pay it, Pharmacy, there's an SPAC program. The pharmacy may come in and help you. It may give you samples the rest of the year. That's the way they got to work it out. Manufacturer may come in, but that's why they have that step therapy to see if you can, what they can try. But it may come down to that's it, because $1,000, that's what you got to have.
I have a question.
Yes, ma'am.
I know people keep, before I've checked the people insurance, they don't cover my doctors at Baton Rouge Clinic. So
Well, who that?
people-
Can we talk about that? Can we talk about that one-on-one? I don't want to. See, I don't want to single out anything else to tell you anything, because I don't have enough detail. Okay, but see me afterward. Let's talk about it. Okay, and you're on the list, right? Okay. Anything you want to talk about personally, any issue you have, any help you need, we there for you. Anybody tell you about me, I will fight to the tooth end. I will fight to the tooth end on any issue, any situation. We're going to fight together. And like I say, right now I'm batting 10 for 10 on big issues. You know, we know how much we save people here. I've saved several customers, different customers, from $25,000 to $50,000. Now, it sounds great, but somebody didn't do something. You know what I'm saying? But the beneficiary, I call you Benny, the beneficiary is the one that got the burden of proof on. You got to figure out, well, we didn't get the bill, or you know what, we don't know. And then the thing goes to billing, and then it goes to the collection agency, and so because somebody didn't do something along the way. Code in there, whatever. Yes, ma'am.
You gave us your name.
Right.
Can we get your number? I don't have a.
Well, you call the numbers on those brochures on your the blue brochure. Ask for Ron Williams. Ron Williams, or you can talk to anybody in ship.
Okay, and this right here?
Yeah, right. Yes, ma'am. Yeah. RNELD, Ronald Williams, or you can talk. You know, if you call the insurance department, ask for Ron. There's a Ron Henderson and a Ron Williams. I'm the old Ron. He's the young Ron. Even though he's bigger than me, he's bigger than me. You know.